Thank you, Chairwoman Eshoo. And I want to, as you did, welcome everyone back for our first Health Subcommittee hearing of the 117th Congress. There's no more pressing issue to begin with than the ongoing COVID-19 pandemic and our response so far, and our need to increase vaccinations, testing, and mitigation, and building a robust supply chain. This pandemic is taking a devastating toll on families and communities all around the country. As members of Congress, we have to do everything we can to ensure that this new administration has all the tools and resources it needs to crush the virus. With President Biden in the White House, I am confident that we can move forward with comprehensive action to stem the tide on the virus. Now, one of the first orders of business will be jumpstarting and sustaining a robust vaccination program after the scientific breakthrough of two safe and effective COVID-19 vaccines, and hopefully more on the way. We must do more to confront the challenge of getting the vaccine into people's arms. Unfortunately, the Trump administration failed to prepare and provide resources for a national vaccination campaign and never developed a comprehensive national vaccine plan. Instead, the administration pushed all responsibility for distributing and administering vaccines to the states, and then they made that job nearly impossible when they opposed providing the states with additional resources to do so. And this failure of leadership led to only 3 million Americans being vaccinated by the end of the year, far short of the 20 million that the Trump administration had promised. Yesterday, we heard at our O&I subcommittee, we heard from states on the front lines about these vaccination challenges. While we were pleased to hear about how they have improved vaccination rates in recent weeks, they underscored the need for additional resources and clear, consistent communication as they work to get the vaccines in people's arms, and their insight is critical as we chart a better path forward. In December, Congress stepped up and provided $7.5 billion for vaccine distribution activities, including $4.5 billion to states in the final omnibus and COVID relief package. And so vaccination rates are increasing, but if we're to accelerate both production and vaccinations, more resources are needed, especially resources dedicated to the most vulnerable, hard-to-reach Americans. And the same can be said for ongoing needs related to testing and contact tracing. From the early days of the pandemic, public health experts and House Democrats were calling for a comprehensive national testing strategy that would ensure testing supplies were allocated efficiently and tests were available to all who needed them. But unfortunately, just like with vaccines, the Trump administration never created a comprehensive national testing strategy and turned over virtually all responsibilities to the states with little support or guidance. Now, I want to emphasize testing again. Testing regions and supplies like pipettes have continued to face shortages, and as new outbreaks have occurred, new bottlenecks in testing have followed. And while we work to vaccinate all Americans, access to reliable, efficient, and speedy testing, contact tracing, and mitigation support will continue to be critical if we're to reduce transmission and community spread. And we also need a more robust and reliable medical supply chain. While states are administering more COVID-19 vaccines, they're running up against supply shortages of doses, but also the ancillary medical supplies, such as syringes that are used to extract every available dose. And while some early therapeutics have been authorized by the FDA, their limited availability has also curbed their impact. And so we also continue to face supply challenges for administering tests like reagents and swabs, and supply challenges remain for critical personal protective equipment for medical personnel, including in nursing homes, vaccinators, and the public health workforce. So I'm pleased that President Biden has taken swift and decisive action to improve our response to the pandemic, as you mentioned, Madam Chair, but crushing the virus requires more action from Congress. President Biden has proposed the American Rescue Plan, which includes $20 billion in funds for vaccine distribution administration, public awareness, and additional resources for improving our supply of vaccines. It invests $50 billion for testing and contact tracing, including expanding community-based and mobile testing sites, and it includes $10 billion to help support expansion of medical supply manufacturing capacity. So Congress needs to move President Biden's American Rescue Plan as quickly as possible. I know that process is beginning on the floor this afternoon, and I look forward to hearing from our witnesses about their thoughts on the nation's response to the pandemic so far and how we can improve going forward. So thank you again, Madam Chair, for this very important hearing of the Health Subcommittee. I yield back.